I'm Alan Payne. I'm the Group Product and Engineering Director for the Health Support and Care Division of Access Group.
My name is Amanda Irvin Obemiosor, and I'm the Head of Healthcare Consulting for Cognizant Technologies.
And I'm Kevin Lassett. I'm a Partner Development Manager at Microsoft, part of our global partner.
So we're absolutely delighted to announce a partnership between Microsoft, who are the world's leading company in cloud delivery systems, and Cognizant, the world's best implementer, if I may say, to deliver something really fantastic for our customers. The project is based around creating a completely new way for how healthcare is delivered, particularly within the mental health, community health environments. What we're so excited about this is that it delivers a completely reimagined way for how clinicians and carers can actually use the system. So it's beyond a database change. This is about a fundamental rethink of how we actually construct the user flow of how they leverage the system. But it'll benefit all of the stakeholders around the system. This isn't designed purely for clinicians or the carers. It'll be designed around the stakeholders surrounding the person that they're caring for, the patient, the service user, the citizen. And what's exciting about that is that there are 5 million unpaid carers in the UK alone. And if we could engage them as well in the care of this, we're actually solving a fundamental social problem as well.
I think I'm most excited about this because it's not just a technology project. Cognizant is a big technology services firm, and so we often run big technology delivery projects, but this is well beyond just a technology project. This is really about the experience of the end users, the experience of the clinicians, the people who are spending their day caring for patients, caring for service users, caring for those people who are most in need in our communities. So I think that's what gets me most excited, that this is well beyond just technology change. This is really about reshaping the experience, rethinking how work can be carried out, rethinking about how tasks can be done in the most efficient, most innovative way, and actually leveraging the kind of technology base that Microsoft offers in your development platform.
I think what really excites us about this partnership is the incredible opportunity to kind of invest and partner with Access in leveraging our significant investment in AI in particular in our cloud platform. So working closely with you, looking at best practices and using the capability, AI is transforming the world and we're at the forefront of that. And so to have this opportunity to work with both Access and Cognizant to look at how do we transform those experience from a user perspective, leveraging that cloud and AI platform is incredibly exciting in terms of what we can bring to get to market.
So the clinical and customer involvement is actually at the heart of how we're going to deliver and operate this system. The big problem that we face is friction in the healthcare system, the ability for you to move people out of a bed into the community, the ability to make their care at home far more frictionless. And that's exactly why we're embedding the user, the clinicians, the carers, and the stakeholders, the people that sit around the care of that individual, at the heart of the design process.
I think being able to really leverage that integrated care model, we talk about integrated care as though it exists, but the reality is we're just on the forefront of really trying to understand how do you create and enable a properly integrated care system, both with health and social care and all the surrounding parts working together to actually deliver the best experience and the best outcomes at the most efficient cost for the community and for the public. So I think that is a really, really exciting opportunity here that we have, particularly working with Access as you have such a broad portfolio of products across different stakeholders.
And I think from our perspective, again, leveraging the platform in particular around AI, in essence, from an integrated care platform allows you to have a co-pilot to help your health, social, and care, users and ultimately, the citizens be able to benefit from that new way of working, having that skill, all that expertise at your fingertips.
It's like having your own personal data butler. Well, unless you put the customer and the customer of their customer, the patient, at the heart of the design process, you'll get it wrong. It will just be wrong. So by embedding that and having regular show and tells, having regular reinforcement sessions, and by really understanding through the use of personas how we can actually engage with them to understand and make it repeatable, and then calibrate that across all of our user base.
Really excited too to begin to do that early prototyping. Early prototyping of the design is incredibly important in the process. So it's not just about doing months and months of discovery work and then smart designers going back, designing something, kind of throwing it over a wall, but rather getting that feedback from those customers and getting that feedback from those clients early on and throughout the process. So it's not just one touch point, it's constant touch points throughout the process, seeing every stage of the game and getting their inputs throughout the process. I think that that's the right way to go about this, and that's absolutely the way that we're approaching this too.
And I think the opportunity in terms of engaging with Microsoft as a strategic partner here is we can leverage our, industry experience, our technical capability, integrate with our engineering teams, bring our architects, and make sure that from a best practices perspective, you have our input as well in terms of what you can do with the technology and how best to actually leverage it.
And just to recap, I think it's absolutely fantastic we're working with two global partners in this, because as much as we are fantastic in delivering clinical care in this country, there is a lot to learn from other healthcare systems, and that's one of the reasons why we value our partnerships with them both so much. Well, for a start, we've never had the partnerships before. I think that's probably the first one that's fairly blatant. But the second is that we've got an investment which is looking at this from an integrated care perspective. We're no longer interested in the silos. We're now looking at the left and right of the impact of clinical and social care decision making. By embedding those flows, those cross-domain flows in the design of this, we're making it beyond just another Rio. We're making it part of an integrated care system. It's mainly the drive towards this user experience, which is based on current digital thinking and even future digital thinking with the use of particularly Copilot and AI and other mechanisms. And if you think about the world today, it's been digitized. We've been using iPhones since 2008. We've now got workflows that are embedded in a digital process, but they're not systemic. And by doing this and making this design with customers at the heart of the design, with them thinking about the flows, but in a digital framework, not a classical form framework. For example, the use of AI to circumvent the need to go through hundreds of forms to find a piece of information that would actually benefit the care of the patient, that can now be surfaced, even in the frame of a different language for whoever is providing that care.
I think from our perspective, technology is an enabler, right? And this is a new generation of technology, in particular with AI. And so this is a real opportunity to build a differentiated kind of solution and capability. And that's what excites us, is really partnering with you to see what you can do with all the innovation that we invest in to build your own innovation in partnership with Cognizant.
In addition, I would say that it's really nice to see the business objectives of this particular program. So often when you think about new releases, you're always thinking about tech debt, and you're thinking about how you sort of undo the things that you had done in previous releases. And so you spend a lot of time and energy thinking about the technology and thinking about the tech debt. And that is no longer a conversation point, right? This is truly starting from scratch and starting without all of the kind of limitations or boundaries, parameters that you often find when you're just doing a typical upgrade or a new release. Even with major release cycles, you're still kind of bounded within this parameter that you can work within. And this has blown open the opportunities to really change the game.
So our effort is forward focusing, not backwards focusing. So that gets better value for the customer and their customers. Well, this is just the start. So we're starting with the UK. But we have huge global aspirations. The design will be multilingual, multicultural, multi-capable across many domains, and it will be able to link left and right to other care and support domains. So the idea is to create something which is compelling, not just for the UK, but actually globally to support global customers.
I think too, the extension of this really deeply into not just the healthcare community, but into the social care community, because they're so interlinked. And so the ability to take this as a model and say, look how you can transform, truly, properly transform the way that care is delivered and extend that into the social care settings, I think is a really exciting example of how we're able to then take that and showcase where you're able to find greater efficiency and benefits in other industries and other sectors.
For us, this is, a next generation of technology, and we're just at the start of it. So this is a journey. We have a lot of kind of applications and capability and foundations in cloud that we have to bring to offer. And I think really working with, Access and Cognizant to unlock that potential, to really transform the relationships and transform the experiences is just, again, an exciting time with new opportunities.
So it's Healthcare Reimagined as well as Rio Reimagined.